Diabetic retinopathy is a condition where a person is suffering from diabetes, either type 1 or type 2, is uncontrolled in nature that might cause the disturbances in the visual acuity and the field of vision, such as blurring of vision. You see black spots in the visual acuity in the field of vision, as well as blindness that might be caused due to uncontrolled diabetes. In diabetic retinopathy, the main causes of the damage is because of the blood vessels that are present in the retina that supply the retina. So these blood vessels are main supplying the oxygenated blood to the retina get damaged due to high sugar levels in the blood. In the first 3 stages of diabetic retinopathy that I have explained to you, some stages can be reversed, whereas you don't see any visual disturbances, or in case of examination done and you do find any damage done, it can be reversed in some cases. There are various methods that can be used to prevent blindness in the 4th and the later stages of diabetic retinopathy. These include anti-VEGF injections, that is anti-vascular endothelial growth factor injections. You can give them laser therapies as well and corticosteroids and prevent infections that might occur because of this. Other than that, there are not much that can be done to prevent the loss of vision. So my suggestion would be to prevent the progression of the diabetic retinopathy into the 4th stage and also prevent it from happening in the first place. These are formed by non-communicable diseases. So if you have a control over all these, such as diabetes mellitus and having a controlled sugar, dyslipidemia where having a controlled cholesterol triglyceride level in the body, hypertension where managing the BP, as well as having no habits such as smoking, can also prevent the progression of the disease. So you might be wondering, is a diabetic retinopathy a condition where you might experience vision loss or loss of vision? Maybe see. But as I explained to you, that the condition may occur only in the final stages of the diabetic retinopathy. That includes the 4th stage. So in the initial stages of the disease, it can be reversed. So there are many stages where the diabetic retinopathy cannot be reversed, as I have explained to you, but they can be prevented. What are the steps that can you take to prevent this? Such as lowering your cholesterol levels in case you have dyslipidemia, controlling your sugars in case you have diabetes, and also controlling your blood pressure levels in case you have hypertension. These are the basic things that can be done to prevent the progression of the disease. These are non-communicable diseases. But there are also other medications that can be given, such as corticosteroids. We can give you anti-VEGF injections. We can give you other laser therapies that can also prevent any injuries further taking place, and also to prevent neovascularization. These are certain steps that can be taken to prevent the disease from your side as well as the doctors from our side. This is a collaborative effort between the doctor and the patient, and if the patient is compliant enough with the advice of the doctor and his team, this is an easily manageable and a preventable disease in a person. So I suggest you take care of your sugar levels, your hypertension status as well as a lipid status, and do a regular health checkup in case you have been diagnosed every 6 months, so that the progression of the disease can be gauged and the treatment can be given adequately. These are few steps that can be recommended to prevent as well as management of diabetic retinopathy.